Ms. Beatrice, with your permission and with Dr. Ozzy, we would like to start. Do I
I'm
have the
ready.
permission to start?
Yeah, we can go ahead. Thank you.
Okay, thank you. Okay, good afternoon, ladies and gentlemen. Good afternoon, viewers, and good afternoon, members. I welcome you once again to the August edition of the Allianz World Healthcare and Business Consulting Entrepreneurship Webinar Series. My name is Dr. Ademolu Oyele. I'm the managing consultant of the organization, and it's something we do regularly to provide to serve as a means of reminding ourselves and also to educate ourselves by bringing in top experts in different areas, in different fields, with particular focus on leadership, management, entrepreneurship, innovation. But today we're discussing something very, very important, something exceedingly very important, which is we're discussing emergencies. Emergencies. It is the unpredictability of emergencies that makes them even more important. You cannot predict, you cannot decide and determine where emergencies happen or when they happen. A good example is something that happened just, I think, less than 48 hours ago. That happened. That's like the first train derailment we've had in a long time in Nigeria. We had a derailment somewhere very, in between, probably in between Abuja and the destination. So you cannot exactly predict where you can have disasters. You cannot predict where you can have medical emergencies. You cannot also predict when it's going to happen. So what this tells us is that it's important that we plan for them, we are prepared for them. And this is the reason why today we're going to talk about emergency response. And beyond emergency response, we'll be looking at what the future holds with regards to emergency response. How is the global world responding to emergencies? What is the world looking at? And this is the reason why we have a topic in front of us, which is the future of emergency response. Technology, data, innovation, and community resilience. How does data, how does technology, how can resilience help us to be effective? How can it help us to be more efficient when it comes to emergency response? So to do justice to this discussion, to do justice to this topic, I have some experts in our midst, and there are no, look far and wide, and we felt that some of the best people that help are some of the leading voices, especially as it relates to areas like Lagos State. We know Lagos to be the most popular spot in Nigeria. What is happening in Lagos? How can the experience in Lagos help us to shape what's in Nigeria? And then definitely the seat of power, the FCT is the seat of power. So we also look at that. How can what is happening in the seat of power help us to shaping what can happen in the entire Nigeria? And we also know that there are some innovative organizations, in our midst right now, and we feel that, okay, how can the innovation they are bringing forth, how can it help us to efficiency, effectiveness with regards to emergency response? So thank you. Without wasting much time, I'm going to, we have, as I said, we have about 4 experts in our midst. The first of them is Dr. Ozzy Okonoa. He's the program manager for the FCT Emergency Medical Services and Systems. That's the first expert I have. And second expert I have there is Mrs. Beatrice Makinde, who is, the director, Lagos State Ambulance Service within the Ministry of Health. And also we have 2 other people. We have Dr. Ayodo and Dr. Obadoye, who is a co-founder with Health Body Emergency Innovation. And finally, another list, we have Dr. Oluwakolade Abayomi, who is also a co-founder with Health Body Emergency Innovation. So these experts will help us unravel, the current situation with emergency, what the future holds with regards to emergency, so that we'll be able to tackle these menace very, very well, adequately. Because, with regards to medical emergencies, one of the major contributing factors to medical emergencies right now are the NCDs, the non-communicable diseases, like hypertension, cardiac problems, and the rest of them. And we have some very damning statistics. For example, some statistics within Nigeria tells us that what deaths are to sudden deaths in Nigeria. 1 out of 5 deaths are due to what? Are due to cardiac problems. cardiac problems, and a major contributory factor to cardiac problems. You know, 1 in 3 Nigerians, according to WHO, also have hypertension right now. So if you pick 3 people, one out of them, a minimum of one out of them has hypertension. So those are statistics that tell that we need to critically look at, you know, issues of sudden death, issues with medical emergencies, issues how to respond adequately to it. So the first person I'll be calling on today right now is Dr. Ozzy. Dr. Ozzy, I welcome you once again today. But before we talk about the future of emergency response as we have there, can you please tell us what is the current situation in Nigeria generally with emergencies? What is the current situation, you know, with Nigeria right now? And also, can we also look at the FCT as a case study with regards to that?
All right, thank you very much. I want to first and foremost appreciate you for putting together this platform for us to be able to address the issues surrounding medical emergencies. The data you read out is actually staggering, and it could be where we are and the volume of work we have to do. In Nigeria currently, there is a big challenge that concerns medical emergencies, and that's because the average Nigerian one is not even aware of the what to do in the presence of a medical emergency. Now, if you just oppose that with the deaf infrastructure as far as medical emergencies is concerned, or general emergencies, you may understand that there may be a lot of factors or a lot of issues surrounding medical emergencies that goes underneath that we're not aware of. Now, if you look at our general infrastructure as a country, there is no specific emphasis being placed on medical emergencies, as against what Lagos tried to do some years ago in terms of movement of persons from one point to the other. There was this vehicular movement. In Nigeria, on the other hand, there is no means of transporting persons who are, who need medical emergencies or who need quick evacuation in the site of an emergency. Am I being heard? Just to be sure.
You are loud and clear.
Yeah, we can hear you. We can hear you adequately. We can hear you.
Okay, thank you. Now, I'm just trying to say that if you look at Lagos, there was an attempt to create a pathway for the movement of the BRT lane. Now, that does not exist in Nigeria. If you go abroad, there's a dedicated emergency line for persons who are undergoing emergency, whether it be, fire service or, ambulances. That is one general situation we have in the country. However, the Federal Ministry of Health, looking at the situation, also looked at access to emergency medical services, because the mere fact that somebody has been moved from point A to the point of care in a treatment center does not automatically guarantee that that person will have access to care. And so government tried to remove the access of barrier occasioned by finances, by making it possible for persons to access care for the first 48 hours across the nation once such states have been onboarded into the National Emergency Medical Service and Ambulance System. Now, in the FCT, we have a peculiar situation whereby persons do not even know that they can access services when they have emergencies. And this cuts across whether it be emergencies arising from road traffic crashes or other non-communicable diseases that may result, to a person requiring, quick emergency evacuation. Sometimes ago, perhaps about 3 years ago, a survey was done in the FCT to even find out whether persons are aware that they can access care. One thing that struck me in that survey was the fact that everybody who knew anything about medical emergencies, or majority of persons rather, who knew anything about what to do in response to medical emergencies, learned such things on their own. That means that there was no concerted effort to provide knowledge to persons so that they can actually access care quickly in the face of a medical emergency. Secondly, a sizable number of the respondents in that survey indicated that they would rather stand and be taking photographs or recording and then post online. Now, how that saved the life of the person who is in need of care is something that I'm yet to understand. Because you're posting online does not mean that that person is going to access care. Then on a general note, in the face of infrastructure, FCT is just waking up. It was only recently that we took delivery of about 12, ambulances to be able to respond to medical emergencies. That is in addition to the ambulances that are available in the secondary healthcare facilities, that we currently have. So now we're trying to really restructure the emergency medical architecture in the FCT so that we're able to respond, to emergencies that are medically related. And a case in point, classically, is what happened, just like you mentioned at the Koba terminal of the rail between Kaduna and Abuja, where we had to quickly respond to a derailment that resulted in injuries to some persons. So I think in a nutshell, that's the situation in Nigeria, and then that's also what we are currently facing in the FCT. Thank you.
Yeah, thank you so much, Dr. Ozzy. Thank you so much. I appreciate that that feedback from you. I'm happy to hear that you mentioned some of the gaps within the system, and I'm happy to also hear some of the transformation that you are already rolling out. Example is the 12 ambulances that you already talked about that you just recently brought into the system. That's a lot of great works by the mandate secretary and your team. I'm also happy to hear about a very good one, which is a practical situation, is the train derailment that just happened. The response, the feedback we got was that the response was impressive, from the entire FCT team, and also the road safety and the rest of them. So I think that's a very good one. That's a practical demonstration of some of the transformation that you are already leading. So I move on to Lagos. So I think I'm going to extend the same question to Mrs. Beatrice Makinde. Can you also tell us, before we go further, what's the current situation of emergency response from your own perspective in Nigeria, and also using Lagos State as a case study? And are there any transformation that that has been ongoing within your system towards bridging the gap that we have seen in emergency response? Tell us, please.
Yeah, thank you very much. Like we all know, Lagos is Nigeria. And currently in June 2025, we can see that Lagos State Emergency Management will launch a flood-free Lagos campaign. We map out the flood-prone areas such as Etiosa, Oshofẹ, Lekki, Apapa, and Amuwo-Odofin, and we set up pre-relief camps because we know when there's flood, people are displaced. There's no how you have to put them in a settlement. And also we emphasize on the readiness with emergency number, which we have the federal, which is 112, and we have the 767. Then there's strengthening of our drainage and flood abatement. Like we all know that Lagos is surrounded by water, and as we all know that there will be flash flood, especially when there's a heavy rainfall, like what we witness these days. And like even what we see in Nigeria as a whole, because some states are prone to this flooding situation. So for like areas like Lagos Island, we have what we call the Ilubirin. There is a pumping station there where where the places that are flooded, the waters will be pumped into the lagoon. Because sometimes that our drainage system, with the effort of the government, you see that people still put all their debts in the drainage and sort clocking it and making it to have a flash flood. And when we talk in terms of emergency, that is maybe like road traffic accidents, we know in Lagos State we have a standard and we have a response mode that we call the critical care rescue operation, which is a command and control center. This command and control center, we have all the stakeholders of emergency, talk of emergency service, Lasambos, we have Lasema, we have the RRS, we have the fire and safety, and we have the safety commission. So all this, we work together and we work on what we call a CRM. Once there's an emergency, it pop up and everybody that's emergency stakeholders, it's just like when there's fire incidents now. With a fire incident, people will be injured. So all the emergency responder will move immediately to the scene of that incident, and we work together. Presently in Lagos State, we have 36 ambulance, functional ambulance, that is for the state government. And then our hospitals, we have over 200 ambulances, even private hospitals too, they have their ambulance. Because before you can register your hospital by the FEMA, they must certify that you have a functional ambulance that can respond in an emergency. And Lagos State, with what we have, everybody know this emergency line. And even other people from other states, they bring in their indigents. And before you know it, they put them on our roads. And some of them are critically ill. And the government of Lagos State, they've really tried, because sometimes it's even more than 72 hours. Because after taking this patient to the hospital, you stabilize them, nobody cares for them, nobody pays. The state government pays for all this money that the patients, will incur. And then when we talk of in terms of emergency measure, you see that the government is really putting more investment in security. And that is when you see in May 2025, we strengthened our emergency architecture. That is, we recruited 100 forest security officers, doubled the allowance to motivate them, and then they distributed almost 320 security kits, and then give them bikes. Presently, as I'm telling you, we have what we call the ambu bike. We have an ambulance that is motorbike, super bikes, 10 of them that we've just incurred. And as I'm telling you, between now and next week, I think they should be in operation. And also we have what we call our boat ambulance, and which are used to reach the hard to reach areas like the riverine areas. And then we collaborate with LASEMA, which is Lagos State Emergency Agency. And when there's a disaster like collapse building, we will all work together with LAPCA, those ones that are in charge of building. Lagos with collapse building. So we all work together. And then going forward, we all just launched our ambulance points, because we don't operate in hospital. We operate all the 5 divisions of Lagos State, so that at any given time, you can reach the ambulance service. Thank you. Thank you.
Thank you so much. Thank you so much for that elaborate response. I think it's very important that doing. Yeah, thank you so much. And even when the government is doing or trying to do a lot, it's important that the people know. The people know, they can see what the government is doing. And I think it's a very good one that you reeled out some of those things. Thank you so much for that. I heard about the boat ambulances. I heard about, the ambulance point. I heard about some of the other things that, but another thing I heard about is the payment. You talk about the government pays for it, but, are people very aware about this? Can you quickly speak to that? 30 seconds before I go to the next person. Mrs.
Course.
Makinde, are people aware that the government is able to pay for emergencies at the point that it happens? And how well are the third party ambulances, how well are they reimbursed with regards to this? Because this will help a lot towards, yes.
We know people are aware, and the health insurance scheme, what we call the LASHMA in Lagos State. That's the health insurance scheme. If you are a premium of a health insurance scheme and you are involved in an accident, what happens is that just tell us where the hospital you use. And if you don't have anyone like vulnerable, because some people can be involved in an accident, during that time, with the nature of Lagos, the hoodlums can come there, takes away with all what the person has. Even sometimes, for example, an unconscious patient, sometimes we can't even trace their relation. So the patient will be there, maybe after gaining their consciousness, and all the money incurred during that period, if the patient cannot pay, gladly the state government pays. And then we are panel with the NEMSAS. So that's the National Emergency Agency that Dr. Ozi mentioned. Yes. So the private ambulance too are empaneled into it. So
Wait.
once they bring whatever that is incurred, it is being, sent to the appropriate quarters and they are being paid.
Okay, thank you so much. That's good information for our people. So to the next thing round, Dr. Abayomi, I'm coming to you. I know that you're one of the co-founders of the Health Body Emergency Innovation. So can you tell us what actually inspired, you and your team to come up with an innovation like this? We've heard about it in the media and things like that. What actually inspired this innovation? Can you tell us?
Yeah, thank you very much, Dr. Adimodu, and that's a very good question because I would rather say why not? Because I mean, my own personal background, it comes from emergency medicine, right? So over the last 1 or 2 decades, personally, I've been involved in a lot of medical evacuation, across the globe, from Africa to Europe, and you know, and I see the difference, actually. I see what happens in a country like Germany, in a country like Italy, France, UK, how in the level of literacy when it comes to emergency response, even by the common citizens. So, I mean, I've been to some very funny situations where we see patients handled anyhow during emergencies, or we see people carrying their cell phones, taking videos, snapshots, not helping the patient or the victim. And because of that, we started thinking, I mean, and again, we have the gaps within the industry, like everybody has said, there's infrastructure gap, there's a deficit, or human capacity deficit, and the likes. That means that people should be able to help themselves. That's what it means. And if that's the case, how do we go about to empower the people to have the skills about first aid, since they are the first responders on the site anyway, on scene? And we look at the statistics. For us to train people in a classroom, right? For us to train people in a classroom, 1 million people, it will take almost about 100 years to train people in one classroom. So that brick and mortar approach cannot work because of the current issue we have in Nigeria and Africa. Right now, we're saying 1 in every 3 Nigerians is hypertensive. Number 2, sudden death is on the increase. We all know it. We all hear it. I mean, we see stuff happening on the road every day in our homes. People are collapsing. In fact, sudden death will be the number cause of death in Africa by 2030. That's what we have. But guess what? Most of the issues about sudden death is accident, whether it's a heart attack, whether it's stroke, and they happen outside the hospital. That means there's that opportunity for us to save more lives if only people know what to do during that what we call the golden hour, of an emergency. And so, what, let's go about a social campaign. How can we engage the community, to upskill themselves in basic first aid skills? And we said, why don't we go on this campaign and create QR codes, video aided QR codes that anybody can scan and learn on the spot. 1-2 minutes videos that are highly instructional. A layman can learn it. You don't be a nurse to learn it, and you can just scan and watch what to do. You can see who to call. You can know how to escalate and what not to do during an emergency, which is very important. So we thought about this, and I came together with my team and say, you know what, let's get this going. Let's start this campaign for the next 3 years. Let's flood the public in the market space, in the offices, at the airports, at the bus stations, whatever it is. Let's put this QR codes there so that every Nigerian can learn. And by our own calculation, we hope to train about 50 million Nigerians, not necessarily in advanced skills, but at least those basic steps you do on, during an emergency. That's how we came about the health body concept. So it's your friend, it's your self-care partner that can run you through scenarios of emergency, whether you're in your home, you're in an office, or you're in your car. Whatever it happens, just scan your body. You can scan, you can learn it, you can save lives. That's how you all came about. Thank you.
Yeah, thank you. Thank you so much, Dr. Abayomi. I think if I heard you well, hello? Hello?
Yeah.
Yeah, thank you so much, Dr. Abayomi. If I heard you well, you said a lot of things about people trying to empower more people to be able to do something in an emergency. So really, the focus of the health body innovation, according to what you're telling us, is more about empowering a large scale amount of people to be able to do something. You felt that we cannot use the brick and mortar approach of going into offices to train few amount of people. Even if we spend 10 years, we may not be able to train more than 100,000 people through the brick and mortar. So you felt that you need to apply technology to be able to, upskill the number of people that will be able to do something during an emergency. And that's what you feel the Help Body Emergency Solution does. And I think that takes us to the next question, talking about community resilience, community resilience. But before I go to that, can I ask everyone here, can we put our contact number in the chat box, please? Because I remember that when the hardware health team came, I think part of the reasons why we are here is that we want to be able to communicate with ourselves, even when we leave this platform, for us to be able to engage ourselves. So can we put our names, our email, and phone number so that we'll be able to, so that we can even get across that information to us. Even by the time we finish, we may be able to send the recording to everyone. So thank you very much. So do I have Dr. Ayodot on there? Dr. Ayodot Bobadoye, is he there, please? Can I?
Yes, I'm online.
Okay, thank you. Thank you so much, Dr. Bobadoye. Thank you so much. So before I go to community resilience, because I understand that Dr. Abayomi has been talking about the community. So it's as if one of the major goals of the Health Body Innovation is to make emergency response reach out to everybody in Nigeria. And he has talked about the 50 million people. Also about the project. So, Dr. Bobadoye, are there any other gaps that you feel that the Health Body Innovation can help to bridge within the Nigerian ecosystem?
Thank you very much, Dr. Oyele, and good afternoon, ladies and gentlemen.
I didn't finish that thing that we are doing downstairs.
I'm so happy to be on this platform, please. Can we please mute our system so that we can speak from one place? So thank you very much, Dr. Oyele. I'm so happy to be on this platform today. Just from the discussions from earlier speakers, there are two things that are very clear. Number one is the statistics that people are rolling out. First one is that 9 out of every 10 Nigerians don't know what to do during an emergency. The second one is that 1 out of every 3 Nigeria is hypertensive, and that makes him naturally predisposed to heart attack and other related health emergency. And number 3 is that people don't know what to do during an emergency. So the frequency and intensity of emergency is increasing in Nigeria. And the truth or the fact is that almost everybody has a story to tell. People losing loved ones because of medical emergency. And the reason why we call it emergency is that it doesn't give you quick notice. It won't tell you that I'm coming on Monday, get prepared. So the whole idea about medical emergency is for you to be prepared to know what to do anytime it happens. And there are 3 questions that we're trying to answer with everybody. The first question is, what do I do during an emergency? The second question is, where do I go during an emergency? And the third question is, who do I call during an emergency? And that is a 3 holistic or belief response to emergency anywhere in the world. Because during an emergency, the first few minutes or within the first 1 hour is the most important time, especially medical emergency. And if you don't maximize it, that time, you may end up losing the patient. So for everybody, those are the 3 questions we've tried to answer. And the first one is, what do I do during an emergency? The Health Body platform has produced Nigeria or African-centered and African-directed films or videos, about 5 different videos that relate directly to medical emergency and relate directly to our environment and to our culture. Videos on heart attack, what to do during heart attack, what to do during seizure, what to do during accidents, what to do during maybe a child has seizure or a child is choking when he's eating in the house. So we have 5 different films like that, videos like that on the platform that you can scan and learn and understand clearly what to do from beginning to to the end how to respond to an emergency, whether it is heart attack, whether it is seizure, whether it is a child choking, whether it is an accident, car accident or something. That is the first thing we'll try to address. And that is the most important part. Like Dr. Abayomi said, if we have to train every Nigeria, the next 20 years, we cannot meet the target we want. But with those videos, clearly targeted videos, every Nigeria can have access to those videos and watch and know what to do during an emergency. And the idea actually is to have as many Nigerians as possible have access to those videos. Put it in every public space, put it everywhere that people are, so that as many people as possible in malls, in hospitals, in schools, everywhere, so that everybody will have a clear understanding of how to respond to emergency anywhere and anytime it happens. The second question is, where do I go during an emergency? The second issue is that emergency can happen anywhere, and a lot of people their hospitals may not be closed, or some don't even know where the nearest hospital is. So what we've tried to do with that is that the main hospital, working with regulatory bodies in Lagos and Abuja, the main hospitals in the major cities in Nigeria, we've tried accredited hospitals, we've tried to georeference these hospitals on our platform, so that anywhere you have issue, in the major cities in Nigeria, you can use that platform to check and know the nearest hospital to you, and not just hospitals, the ambulance centers, so that you can have access to the ambulance centers. And that leads us to the third question, which is where to go. Once you call the hospital, then you have access, georeferenced access to where the nearest hospital is to sort your problem, to address the emergency. So the three issues around the emergency, once you get it, stabilize the patient with having or knowing what to do or how to respond to an emergency. Then you check your platform, identify the nearest hospital or the nearest ambulance center to you. You make a call there and you go there. So with that, we are trying to have an holistic and a comprehensive approach to emergency response in major cities in Nigeria. Know what to do, know where to go, and know who to call. That is our motto, and that is what we're preaching to every Nigeria, putting it everywhere in every public space, so that every Nigeria will have access to it, and we can reduce the number of unnecessary deaths from medical emergencies as much as possible in the country. Thank you very much, Dr. Oyele. I'm so happy to be part of this webinar today. Thank you. Over, please, Dr. Oyele. Can you hear me?
I
Hello?
think his network is having problem, but we can hear you. I don't know.
Okay, fantastic. So I guess we should hold on for him, and hopefully we'll come back soon.
Yes, sir.
In the meantime, while we wait, I just had a question to the person who presented this platform. Could you maybe share the name of the platform again so I could have a look at it, because I thought it was very interesting. Thank you.
Okay, so what we have right now is okay. Maybe I have my tech guy here. Williams, can you hear me? See, I think he's on the platform. Williams, can you hear me? Mr. Williams, can you hear me? Mr. Williams, Odayinka.
Yes, I can hear you, sir.
Mr. Williams, can you hear me?
Yes, I can.
Okay, so I mean that's a question for you. they were asking us about the platform. So how does it work and what are we hoping to achieve with the
Hello, can you hear me now?
the portal and
Okay.
Yeah, we can hear you, but we are
Yeah, we can hear you.
Welcome back.
So sorry, I don't know what happened. It just went, it ceased. So I had to quickly join in with the mobile phone now. The laptop ceased. So no problem. Thank you so much. Thank you, Dr. Bobadoyi, for that insightful.
We have a question we're answering right now. So
okay.
Yeah, so Williams, go ahead.
Okay. Right. So thank you for that insightful
discussion. There's
yes.
One question that was asked. So let's just quickly address that and move forward. Someone asked a question, so we are trying to answer that. Okay. So Dr. Williams, go ahead, please.
Okay. So the question he asked was he wanted to see the platform. So that one I would share to him through chat now, and also for the platform, it's a QR code enabled platform which everybody's aware about, and yeah, there's a lot of hopes for it. It's on the developmental stages, but it's also informative. It's a place where you can easily. Oh, okay, that's your printing, right? Is that your name? Yeah. Okay, got you. So I would send you the link to the platform so you can see it. So Mr. Adebolu can continue now.
Thank you very much.
Yes. Thank you. Sorry.
Okay, thank you so much for input, and thank you, Dr. Bobadoyi, for the insightful discussion you gave. I've heard so much things about what the health body is doing with regards to people, amplifying the number of people that can be first responders. So now this takes me to the question: community resilience. Community resilience. So, can Mrs. Makinde Beatrice, can you tell us? Can you define for us what do we mean by community resilience? What does it mean to say that a community is resilient, within the context of emergency response? And are there indicators that will show that a community is truly prepared for disasters or emergencies?
Yeah, thank you very much for that question. The community has a well-developed emergency plan, because what Lagos say, what we do is that all our local governments going further will have an emergency ambulance station. Because as I'm talking to you currently now, we have a building in Kushofe local government, which is going to be our forwarding ambulance point, because normally we stay outside the major road. Sometimes we have been attacked by armed robbers, hoodlums, lunatics, but because the local government now are giving us a land to build a structure, and with that, you see that they are also included. And then we do conduct regular drills and exercise, and has a clear understanding roles and responsibility. Because in an emergency, when an emergency occur, accident or any disaster, we see that the first responders sometimes are the community, because they are close to these people. Then we have our social cohesion, strong social bond and network. It exists among the community member, fostering a sense of trust, cooperation, and mutual support.
Okay, thank you so much, Ms. Beatrice. Thank you so much. So now, can you help me with that? Are there indicators?
The government said, okay, this, we want a community engagement or first aid, and if they see it happened, they have that trust in the government. Infrastructure has a robust, including our emergency service, our healthcare facility. We have a communication system that can withstand the response emergency. In terms of economy, the community has a diverse economy, access to resources, and a plan for economic recovery in event of disaster. And then another thing, we engage the community in actively engaging emergency preparedness and response efforts. Then we have effective communication. The community has a reliable communication system, including emergency alerts, public education campaign, and social media platform. They have access to resources. The community has an access to resources, including emergency funding, equipment, and expertise to respond and recover emergencies. Then we have what we call the emergency medical services. It's a well-developed emergency system in place, which we train and to assess all the healthcare, especially in disease surveillance. If you know, we just passed the stage of cholera in Lagos State, and which we are able to, cope. Then in disaster risk reduction, the community has implemented disaster risk reduction measures such as flood mitigation, earthquake, though we don't have earthquake, but also we mitigate them in case it happens, which we don't pray for, and we are well prepared. Then we have the community education, which community education in response in emergency recovery, including the train, like I said, first aid, CPR, and disaster response. We have a collaborative and partnership to establish partnership with emergency response agency, healthcare providers, and other stakeholders. And by focusing on these key indicators, community can build resilience and improve their ability to prepare for, respond to, and recover from emergency disaster and crisis. Thank you.
Yeah, good. Thank you so much. Thank you so much, Mrs. Makinde. Thank you. Quite insightful. I think, you've been able to give us, you've been able to tell us that, the community is a major part of emergency response. And there are certain indicators. Some of the things you mentioned include the communication. When there's a very good communication system between the government and also the people, those are clear indicators that, okay, we are building resilience, because you may need to alert the people once disasters is happening or there are emergencies and things like that. You also talked about funding so that people know that, okay, when things happen, then there will be a system for economic recovery. So those are pointers to show that there's resilience that is building up within the community. And the most important part that you mentioned is in the area of the community in the front line of responding. So now I want to hear from Dr. Abel. How can the community being the fourth line of responders, how can the help body innovation, how can it bridge that to make sure that the community is now the fourth line of responding? So how do you think the innovation, the emergency innovation, help body can bridge that gap to ensure that, almost everyone can become a first responder? Yeah, within a few seconds. Yeah.
Okay, thank you so much, Dr. Ademodu, for that question. And it's really straightforward because everything starts within the community. That's the simplest unit of any life, So and we reckon that for us to have a robust and a sustainable system when it comes to emergency response within the country, we need to start from a community. Because guess what? Most of these emergencies happens in the rural areas, in those areas where they don't have help. They are very far from healthcare resources. They don't have they have limited funds even to access healthcare. And and that's why they must be at the forefront so they can even help themselves. According to the SDG goals, which we are all chasing, 2030 SDG goals, there's what we call self-care. Self-care is a very, very big topic for us to achieve the SDG goals. What can I do for myself before help arrives? And that can start from the community level. So a community can begin to drive that initiative where every individual, every human being has the capacity to help somebody in need. Look at what happened over the few months in Lagos. Like you all saw, people carrying people anyhow, they don't know who to call, they don't know what to do, they take videos. That should not be the case. You heard about a case about some years ago, a small guy in the US, mother had a heart attack, and the small guy just carried the phone, a 3-year-old girl, and called 911. And that's what she had to do. And somebody came, an ambulance came, was dispatched. That simple, that kind of information, that level of awareness from a community can help to save a life. So for us, we must drive what we call a community-led response system, whereby your next neighbor to you can claim you're a doctor, but trust me, if you're a doctor, you're in the market and you collapse, who's going to help you? The people in the market before help arrives. So you see, that is very important that everybody should have an idea, in the community. And by doing this, we are building a very resilient system and an ecosystem that can stand, the future that we are all facing in terms of the increase in NCDs and something that we are experiencing. And that's a way for us to combat and stay alive as Africans. That's what I would say for now. Thank you.
Okay, thank you very much. Thank you so much. Now, Dr. Ozzy, I'm coming back to you. So now, Ms. Beatrice has told us, she mentioned something that really caught me off guard, which is the fact that even when the government puts ambulances in certain stations, the members of the community still go there to rob them. Members of the community still go there to vandalize. So really, so how would we build resilience in that kind of situation? So tell us, so what is the role of the community in some of these situations? Do the community themselves have a role to play? Even beyond the government, if the government is trying to do this, what is the role of the community? Another one is this that is common in in Lagos as an example, is that we see that an ambulance is moving, trying to probably take a victim from point A to the hospital, but people are not leaving the way because they feel that the ambulance is actually empty. So what is the role of the community in things like this? Do they have a role to play? I've given you two practical community in things like this. Do they have a role to play? I've given you two practical community in things like this. Do they have a role to play? I've given you two practical community in things like this. Do they have a role to play? I've given you two practical community.
Maybe you are using two devices. You need to
Yeah,
off
exactly.
one.
I'll talk now. The
Please put
second
off
device
one.
just came up. I'm so sorry.
So you need to disengage one.
Yes, that's what I'm going to do. I want to be sure I have the perfect one to use.
Okay. Thank you so much. Hello. Hello.
Yeah, we can hear you. We can hear you.
We can hear you. Go on, please.
Okay. Yes. In response to your question about the role of the community in emergencies, unfortunately, the case you cited in Lagos is actually worrisome, where persons vandalize, vehicles that are meant to convey persons. You will not also rule out the issue of vandalism or vandalization in what happened along the Kaduna-Jere, rather Abuja-Kaduna railway line, because also possible that the rail line itself was vandalized. So we cannot rule out, such miscreants or non-state actors taking, some things into their hands to damage public infrastructure. Now, but if we're able to tackle the issue of miscreants, vandalizing or misusing public infrastructure, and you'll find a situation where by the time you empower the community by way of training or capacity building, you have also expanded the scope of responders. The community that does not take ownership of any event or program will always have this apathy towards the program. And that's why, because the community, for instance, has not owned emergency medical space, it will be difficult for a man who is driving home from work to make way for an ambulance who is conveying a patient from point A to point B. The man who is going home does not even know that that ambulance actually should be given the right of way. There comes the role of the value of education and public enlightenment. We must, as a matter of policy, inform the general convey a patient from point A to point B, especially when that vehicle has signaled you either by way of siren or by the lighting system that it's conveyed a patient from point A to point B. That vehicle has the right of way. It should be given express, route use. But we're living in a country where there's so much abuse of power. The Nigerian of this day has been so abused and insulted by persons who use siren that the sound of siren creates some resistance in this person, whether it be the police or the VIP moving from point A to point B, sometimes for no apparent reason, or some government officials who abuse the use of siren. Siren is not something that should be on if there is no emergency or express need for its use. So we need to first and foremost change the mindset of the people who have access to siren, and then educate the average Nigerian on the value of siren. It's going to take a while. Just recall a few years ago, it was difficult to make the average Nigerian put on the seat belt. But today, instinctively, once you board your vehicle, the next thing you do is to strap yourself on, and then you're able to drive safely. Now, coming to the community itself, we need to really build capacity, at the community level, such that persons are able to respond to medical emergencies. That's why I'm happy with what Health Body is doing by giving people access to information and knowledge. So we must promote emergency preparedness and literacy. The average Nigerian must, by the time we're able to equip the average Nigerian with emergency literacy, he's able to respond quickly, and you now reduce the burden on those who are providing these emergency services, at the government level or even at the hospital. It will also help to reduce morbidity in the hospital setting, because they would have been able to manage these cases a little bit and prevent, only bad cases from coming to the hospital. So in a nutshell, and that's why I'm happy also with what the Federal Safety could train persons along the corridors where there are, frequent road crashes. So if you have persons, vulcanizers, panel beaters, carpenters, who are along corridors where we know are regular, normally where people normally have road crashes, for instance, or that we know are flashpoints, chances of us, improving their chance of persons surviving becomes very, very high. And then finally, as a final roundup, when you go to the local communities, you find that the community itself knows those who are vulnerable. They know the sick. They know where the children are. They know where the elderly are. So it is very easy also for them to keep an eye and become champions of emergency responses. So that by the time they have the little knowledge about emergency, they are quickly able to respond. They are the first on the scene. And it is easy for us to be able to come to evacuate. And this is where I want to commend the National Union of Road Transport Workers who are currently working with us in the FCT, especially in reduction of maternal and child mortality, because they are the first sometimes to go to the community and pick women who are in labor and quickly convey them to the nearest primary healthcare center. And that's what community does. Sometimes we tend to look at community as the local, the village, or the rural area. The community is where you work. The community is where you live. In your estate, the people in that estate need to also be empowered so that they can respond to emergencies. Sometimes it could be the neighbor that is going to save the life of somebody who is suffering from a cardiac arrest, for instance. But what would that person do when there is no emergency literacy? So we must improve the literacy of our community as far as response to emergency is concerned. Thank you. Hello.
Dr. Woyele, you are muted, please.
Sorry. Yeah. So thank you, Dr. Ozi. Thank you for that. I'm coming back to Dr. Ayodeotun Babadoyin. So please, data is said to be the new oil, the new gold. So how can we better leverage data? Data is the currency of the world right now. How can we better leverage data to improve the emergency medical response? So can you please tell us in brief seconds?
Yeah, thank you very much, Dr. Woyele. Yes, data, like they say, data is everything now, because we live in the fifth industrial revolution. And in the fifth industrial revolution is a time where you combine artificial intelligence with human intelligence to solve problems and challenges facing us in our world today. But for you to be able to effectively develop artificial intelligence, the algorithms that goes with it and everything, you need data. Data is a foundation for intelligence. Without data, there's no way you can build any form of intelligence. In fact, the algorithm of AI is absolutely dependent on data. And that is why data is very important in our world today in the fifth industrial revolution. Take, for example, a simple example. We've been talking about everybody and issues with emergency response. Why are we talking about it? Because there is data that states clearly that 9 out of every 10 Nigeria does not know what to do. That is the data that is showing us what the challenge is. We are having data that says 1 out of every 3 Nigerians are hypertensive. That is the data that is showing us what to do. And it is based on that data that we are taking actions to solve that problem. So if that data is not there, we will not even be able to effectively identify where the challenge is. Somebody says without data, anything you're saying is just your opinion. So for you to be able to effectively plan and take decisions, then you have to have enough accurate and adequate data to take decisions. And that is where it is very important in emergency response. Number one, data tells you what the challenges are. It tells you this is where the accident, let's take, for example, road accident. It gives you clear understanding. This is where the challenges are. This is the number of people facing the challenges. And this, with that, you can easily plan what you need to do to address those challenges. So that is what data does. It makes you identify where the challenge is, especially with emergency response. It makes you understand clearly how you can effectively address those challenges. So data is the background, is a background, the backbone behind any form of decision you're taking, whether as government, as individual, or as an organization. Data is the backbone, and that is the only way you can effectively address any challenge you're facing, whether emergency response or any form of challenge facing us in our world today. So that is the importance of data, and that is why data is very important for us to effectively address challenges facing us in the 21st century. Thank you, Dr. Oyele.
Thank you so much, Dr. Bobadoye, Doctor. I think it is said that whoever respects and recognizes his teachers will live long. I recognize the presence of my teacher, that is retired Colonel and Dr. Ruben Nkado. Good afternoon, sir. I welcome you on board, sir. Good afternoon, sir. I saw your name and I felt that it's important I recognize you. You can say hi to everyone, sir. So let's go on. I'm sure by the time it gets that, it's going to say hi to everyone. Yes, as we said, thank you so much, Dr. Bobadoye Ayodoto. So without wasting much time, you said a lot of things about data. So now we also know that in the world, there's so much concerns about data privacy. There's so much concern. Okay.
Yes, sir? I was sorry. I hope I'm not interrupting. Okay. I just happened to tune in because I'm a little busy, but I said I retired somewhat above Colonel. It's okay.
Sorry, sir. That was the last when I was
Colonel when you knew me.
Yes, yes.
Yes, I was a Colonel. All right. Well done, Doctor. Well done.
Thank you so much, sir. Thank you so much, sir. Thank you so much.
Thank you.
Yeah. Yeah, it taught us a lot of things that I know about medicine, even though I moved on beyond the typical medicine, but it taught me a lot of things I knew about medicine. Fantastic teacher. Thank you so much, sir. Okay, so as I was saying, there's so much about data privacy and data sharing. How can we ensure that, we do not erode public trust? As much as we talk about data right now, how can we ensure that we don't erode public trust? Can Dr. Can you quickly end that before I move on to the next person?
Yeah, thank you again, Dr. Oyele. Yeah, in our world today, there are two very important data to every human being. The first one is data about your money, about your finance. The second one is data about your health. Those two data are very important to everybody, and it should be taken very serious. Because like we said, data is a foundation for development. But for every development you should have, anybody's data that you're collecting, you should be able to give a clear understanding of what you use the data for. And that is why in our world, take for example, let me say you want to develop a vaccine. and you need a whole of data about diseases, about, take for example, vaccine on Ebola. During Ebola was a typical case. There are a whole lot of samples during Ebola, collected from Sierra Leone and Liberia and all those things. And those samples formed the background for the development of vaccines for Ebola. But you cannot just collect people's data and samples and use it to develop vaccines and make millions of dollars from that vaccines without giving back to the system that formed the background or the backbone of the research that you did to make that vaccine. And that is why data has become very important. And that is why all over the world today, we have the GDPR in Europe, that is General Data Protection Regulation. We have the NDPR in Nigeria, Nigeria Data Protection Regulation, that regulates how you use data you are collecting. And what it simply says is that you can't just collect people's data and use it, number one, without their consent. And also, it is not ethical for you to use data, to collect data and use it for for commercial purpose without taking consent from those you're collecting it from. And even if consent is given, most times, if it's for huge commercial purpose, without giving back to the source or the foundation of the data that you collected. So data, because of the importance of data in our world today, as a background of a whole lot of things around in the fifth industrial revolution, it is very important for us to have guidelines and rules that govern data regulation so that people will not collect data and use it for the wrong purpose, especially data about health science and data about your finance. Those are the two forms of data that are extremely important today, and we have to manage them very well. Thank you.
Thank you so much. We're moving towards the end of our webinar. Thank you so much. We just have a few other things to talk about. We're in the world of artificial intelligence right now. Everything in the world is artificial intelligence, AI. So now, and at the same time, I know that there are parts of Africa, in remote part of the Africa, drones offer disaster relief and things like that. So that is how technologies have been used to improve, that response, emergency response. And we also know that, as things are unraveling and unveiling, AI will be a major part of emergency response. And at the forefront of this, what is data, because there's limited, whatever AI can do is going to be dependent on the data that you give it. So without data, AI is almost useless. So definitely data, AI, they go together. So we can see the relationship between the two, So if we know that AI is part of the future of emergency response, data definitely is part of this. And so is innovation, So now, Dr. Abayomi, can you quickly tell us, so how do you think in the next 5 to 10 years, technologies like artificial intelligence, technologies like drone, technologies like the health body that you use, how do you think will change the way people respond to emergencies in the next 5 years? Dr. Abayomi.
Yeah, thanks for that question. So, I think it's no brand that we should know that the future of management medicine is going to be with AI. Definitely, that's the future. Because of the way the world is going, and the need to be proactive rather than being reactive, right? So, right now what we do is just what I would call cut and sew. We can't preempt what wants to happen. But we AI, it starts from even a predictive analysis from AI. It can tell you, right, your hot zones for emergencies, something like that, so that you can prepare your resources accordingly. You don't have to wait for someone to call you. For example, we had an app some years ago whereby we're able to, understand the road traffic conditions, right? So on the island to the mainland, this is the traffic period. This is where you are likely to have accidents. So AI can help you gather those information so you can deploy resources accordingly. You don't have to wait if you are called upon, but you can put an ambulance on Third Mainland Beach, for example, because like what Lagos has done, Lagos has put ambulances in different areas because that's where they think they are the hot zones for emergency. They can have access. That's one. So it can predict actually, and it can also dispatch intelligently. So you can optimize your in real time road conditions. What is it? What are they going through on the scene? The victim. What are they experiencing? Is it trauma, severe trauma? Is it heart attack? So that you can also prepare to send the appropriate resources. You understand? Again, it will happen in the back end, so that the ER can also be prepared to receive patients, according to their own capabilities. So not that you are carrying patients from one place to the other without having any intelligence. They're not working blindly. Right now, you know that with AI, it can tell you, even before you get to the scene, this is what I'm going to meet on ground. This is where I need to take the patient. So it can gather this kind of information for you. And last week, you talk about the drones. So drones are here to stay. I mean, you cannot do without drones in the future that we are looking at. Drones are very key because guess what? Where you can't even access, where remote areas, very dangerous scenes, you can send a drone ahead to take a picture, a camera of those situations. It can feed you live information about what you need to do before you get to the scene. So through body cameras, body sensors, a drone technology, you can begin to gather real-time information that a command system can use to dispatch the right equipment and personnel to a scene. And guess that will also save your responders, from injury, on those sites. So drone technology is one of very key. I remember in Lagos when we have collapse of building, you see people trying to carry people anyhow, they carry the bricks. But with thermal drone technology, it can detect its signatures, right? And say, okay, this is where this person is. Let's carry this block gently, and it can evacuate. So it's very key. And I will summarize by this, saying that AI will do a couple of things for us. One, reactive to being proactive, right? We're going to move from a guesswork to a data-driven decision mechanism. We're going to enhance our safety of our responders. We're going to optimize our resource utilization. We're going to deliver personalized care on the scene because we know what is wrong with the patient before we even arrive on the scene. And we have a very robust ecosystem, that can deal with any situation. That's what tech is going to do for us in the future. It's going to be very predictive, so we can prepare and shape policies, accordingly. Thank you.
Okay, thank you very much. So I can definitely help to make our system better. So definitely, I think that is clear. The future belongs to AI, so we have to keep that. Before Ozzy, can you please help us? MSAS, what are they doing to ensure that new emergency response technologies like the health body emergency innovation that people have spoken about, what is the FCT MSAS doing to ensure that emergency technologies like these are equitable and accessible to the communities, including those in limited resource areas? Yeah, thank you.
All right, thank you very much. In the Federal Capital Territory, under the auspices of the Mandate Secretary, we have been able to reevaluate what we've been doing in the FCT as far as emergency medical response is concerned. And I think our focus now is on predictive emergency responses rather than reactionary. We want to be able to predict, the emergencies that may occur so that we are ready well ahead of time. And one of the things that we are doing currently is to see how we can spread human resource across the length and breadth, using or capitalizing on the available human resource. And that's the general public. So we're currently trying to form a partnership or an alliance with everybody in the technology space who can provide technologies that will help us predict emergencies. I think on the path of health body, one thing that I found very, very interesting is the ability to even predict in the back end the number of bed spaces that are available for emergency care. This is critical because no matter how much you prepare, if you are not ready at the treatment centers to attend to these patients, then it's almost time, wasted. So we're looking at predicting, first and foremost, the number of bed spaces that are available for emergency care and responses. Secondly, we want to go to forecast emergencies. And prepare as well as be able to mitigate any disaster that may thereafter follow. What are we looking at really? We want to be able to identify high-risk zones, places where we know that there will be, danger, as it were. And that is why we believe so much so that if we're able to partner with, persons in this space who are data-driven or who rely entirely on technology, then we're able to achieve, the aim that the FCT is, looking at. One thing that has come out very critical and very important in all of this is the use of networked emergency response information system. If you are not able to network all of the things that you're doing in the emergency space, you cannot really achieve what you hope to do or what you hope to achieve. And that's why we're looking at a very strong and highly integrated network of response in the emergency space, so that we're able to, everything is having a handshake, whether it be the number of bed spaces or you're able to geolocate ambulances properly using technology, and also be able to predict, emergencies where they are most likely going to occur. You and I know that with the use of AI now, and let me even put it this way, there has been AI all along, but just that there's so much hype about AI. Google Map is actually AI, and it's able to predict where there's going to be some bottlenecks. I also believe that with advancement in technology, we can actually predict, at the community level, where there's most likely going to be a high incidence of whether it be an outbreak of a disease or an outbreak of an epidemic. And so we're able to prepare well ahead of time. The operative word here is predictive emergency response rather than reactive, so that we get ready and we are set on time. And we would want to commend Helpbody for even coming up with this simple initiative of scanning the barcode. And by simply scanning the barcode, you are able to, improve the emergency preparedness of the average man on the street. That's the use of technology to be able to, improve on emergency response in the FCT. And I must say that we are really looking forward to a strong partnership in this regard to see how we can, improve our preparedness as far as emergencies are concerned in the Federal Capital Territory. Thank you. I think you're still muted.
Yeah, so sorry. So thank you. So I'm saying that I'm facing the Mrs. Beatrice McIntyre right now. Finally, how can technology or data be used to empower the average citizen within the community to be active participants in emergency response and preparedness? I know you said a lot about community resilience. So how can we now use these technologies, this data, to empower people, citizens within the community, for them to now be active participants within emergency preparedness or disaster management? Thank you,
Thank you
Mrs.
very
Beatrice.
much. Yes, thank you very much. Like we all know that data is life. So data, we can use it to empower the citizen for them to be active and to be active in participating in emergency preparedness and response in the following ways. We can use it as a mobile app. Like we know that it's just like Lasambos now, we have what we call a dashboard. These are dashboards capture all our response time in real time. So for example, there's a distress call, the call has been passed, the data, that's the dashboard, we picked the time in a real time. And then for the citizen now, the community now, we'll have a real-time updates from them, because they are the one to be a first responder, to give us as an alert, to help them in staying informed, and they will be prepared. It also have like an emergency alert system that send like alert SMS, email, and social media, which enable them to receive timely updates and instructions during emergency. Because already with this data, we'll be able to know where there is high frequency of, in Lagos, is a peculiar place compared to other states. And then we have what we call the satellite imaginary, which provide critical updates on changing situations like flood or storm, helping citizens and emergency responder to understand the situation better. Then on this, we will not but talk of the data analytics, which is analyzing historical data and patterns, can help identify high-risk area, like I said, and it can also help to predict potential emergency. Then we have our social media and the crowdsourcing platforms like the Twitter, the Facebook, and our next door enable citizens to share information, offer help, and coordinate support during emergency. Another one is that, like I said previously, with the community engagement. And because we have all this data, and they'll be able to tell us. It's just like using a drone, like you've mentioned, in a disaster arena. You see that all these things can be able to, give us the real time of what is going on. We have what we call the IoT sensors, which monitors environmental changes. It detects fire, floods, and structural weakness. Like I told you, we have peculiar collapse building in Lagos. Then, like Dr. Ozi said about the artificial intelligence, which also predict disaster, it optimize the resources allocation and enhance emergency response efforts. So let me just say, summarily, that with this data technology, even we have what we do in Lagos State, that's what we call the bed space management. Like in emergency, some hospitals may be so overwhelmed and they will tell you there's no bed space. But this bed space management, because of the data, we'll be able to know which hospital is having bed, which hospital is not having, in order to reduce mortality and mobility of the patients we handle and the state at large. Thank you.
Yes, thank you so much. Thank you so much, Mrs. Beatrice. Thank you. I'm going to allow a few minutes for questions, if there are any questions, so that we can take them before we quickly have a wrap up. So are there any questions? Can you please raise up your hands or put it in the comments so that we can read them out and we can address them? Are there any comments? Are there any questions within few minutes so that we can wrap up? Thank you so much. I think I have the first person, Mr. Dio Princeton.
Yeah, no, I first wanted to say thank you very much for it. It was very, very insightful. And since I have the numbers in the chat, is it fine if I just reach out to them also for questions and maybe just for cooperations? Because I heard some great things here. Is that an opportunity I can do?
If anyone does not have a contrary opinion, themselves, if there's a contrary opinion, that person can please put it in the comment so that we can, that can be noted, please. If there is a contrary opinion, please put it in the comment. Thank you so much. Any other comments? Any other question? I know that I've been, okay. Go ahead, please.
Yeah, hi, everyone. Wanting to know, what are we doing about the curriculum for paramedics? Because it's a very different skill set pre-hospital to that of a hospital environment. So what special trainings do we have for proper paramedical training within Nigeria?
Thank you very much. I'm going to allow that question to go to Dr. Abayomi Oluwakolade. I know that he's an expert in that area. One thing I know very much is that I know that with regards to the curriculum of so many things in the healthcare space, I know there's a lot we need to do. We need to have specific period that we review our curriculum to make them better, to improve on them, to make them, in tandem with what we have in global standards. But Dr. Abayomi, can you please say something to that?
Yeah, thanks, Eugene. Thanks, Eugene, for that question. I mean, you know better where we are when it comes to EMS training within the country. Apart from Benin Teaching Hospital, that's tried to come up with a kind of curriculum over the years, I'm not sure there's any other institution in Nigeria that is handling pre-hospital care, as it were, as a topic. So we are still lacking, in that area. In fact, in medical school, they don't really teach us. I beg to differ. That part of medicine, pre-hospital medicine, as a curriculum, we are not taught that. We are just thrown into the deep blue sea when we finish. So I agree with you. That has to come as a foundation. If we are to change the orientation of a government and the responders, and the whole operational scenario when it comes to pre-hospital care, we must expand the scope of the curriculum to be tied into university courses, definitely across board, from the health tech to the teaching hospitals, to whatever it is that teaching, medical education. There must be a curriculum that addresses this, and if we are able to do that, trust me, people will be more informed, about what it means to handle emergencies within the country. Definitely.
Yeah, agreed. There is still a lot of education that needs to go around what emergency services is, and like I said, it definitely requires a completely different skill set pre-hospital to that of a hospital environment. I see Beatrice's Mrs. Beatrice has got her hand raised.
Right.
Yeah, thank you very much. Just to add to what he said, currently we are having the first set of paramedics training in Lasut, but that is a Lagos State University Teaching Hospital in Ikeja. But presently in Lagos State, we've written some memos to the governor in order to have it in our scheme of service so that they will have the cadre of paramedics, and they will so help in pre-hospital care, because most of our nurses are traveling out with the Japa syndrome that we call it in Nigeria.
Japa.
So, yeah. So, but currently we've written, I think, like 4 or 5 times, because even in federal we don't have cadre for paramedics. But I think if Lagos State should start, I know other states will follow suit. Thank you.
That's definitely.
Thank you so much. Beautiful. Do we have any other comments? Any other question? We're going to have a wrap up now. Okay, thank you so much, everyone. Thank you very much. We've had a fantastic session today. I've learned a lot, and I know that all our viewers, all our members here have learned a lot. So by the time we also share the recording, a lot of people, I'm sure that will be educating the public well enough. So I think this is what we want to continue to be having, to continue to share knowledge to Nigerians, to continue to educate ourselves, to continue to see how we can transform emergency response in Nigeria through the knowledge and expertise that we have, and continue to see how emergency response can be a front-burning issue within the country. Not enough attention is given to this, and we need to do more. Imagine that the accident that we had within the last 48 hours, that's the train derailment. Imagine that we have something like a health body technology within all the train stations, all the train cabins, such that even before, the entire FRSC team or the ambulances get there, Nigerians themselves are able to actually, do the right thing on accident victims. So we can actually help ourselves. That's how it's supposed to be. If you go into many train stations within the UK, you will even see defibrillators. You see ADs in different parts of the station. That is people that are well prepared. So we need to also be prepared. And part of what is done is that this thing can also engineer a social campaign to make people well aware about what they can do. And I think this is really very, very important. Thank you all. I also noticed that when I was watching the video on TV of the accident victim, I saw quite a number of people that were not carrying accident victim appropriately, even when some of the responders were there. I saw, in the present, that should not really happen. So I believe that with time, as we progress, all these things, we can get to the right point. I also thank, Dr. Ozzy for making it here. Thank you so much. He's doing fantastic work with the FCT MSAS since he joined, and definitely he cannot do this except with the champion that he has above him, which is the Mandate Secretary of Health in Abuja. That's Dr. Fashawe. Fantastic from the Abuja team. I also want to thank Mrs. Beatrice. We all know Lagos State for being pace setter in a lot of things. I want to thank you for what you've done and what the people are getting from you. I also want to thank the health body team. Dr. Olu Akolade Abayomi and Dr. Boba Doye for bringing together a fantastic innovation. And I hope that we can have more of it all around. In our corporate organizations, in our homes, on the street of Lagos, so that everyone knows what to do, knows where to go, and knows who to call in an emergency. So thank you so much, everyone. We're going to call it a day, and very soon we'll be inviting you to our next webinar. Thank you. Have a lovely day. My name remains Ademolo Oyele. Yeah.
Thank you. Bye-bye.
Bye-bye. Bye-bye.
Yeah. Thank you.